Hello, my name is Laura Patrick, and we are doing our monthly Ask the Doc session. And this month's topic's hips, and I'm joined by Dr. Jerry Trinidad, orthopedic surgeon in our Portsmouth office, and he also visits Jackson. So with hips, Dr. Trinidad, I know once you reach a certain age, or if you're very active, you may have hip pain, signs and symptoms. What should people look for when they are experiencing any type of hip pain?
Well, there's different causes of hip pain, and as far as age goes, it can occur at varying ages. But just because you have hip pain doesn't mean that you've got an arthritic hip or a hip that needs replaced eventually. There could be other causes of hip pain. You can have bursitis, or it could be a muscle issue. It could even be a lower back issue, but not always is it an arthritic hip problem. But if it gets to the point where the hip is bothering, most of the time people with hip pain, arthritic pain is groin pain. People have a pain in the groin and the pain goes down the thigh, pain with standing, walking, even severe pain at night that keeps them up at night. If it gets to the point where just simple things like rest, modifying your activities, anti-inflammatory medications, if they're not helping you, it's probably a good idea to at least see your family practice or primary care doctor and get their opinion, get them to evaluate you, and if they feel it's something that needs to be assessed by an orthopedic surgeon, then they would refer you. Or a lot of times we have patients come directly to us if they feel the pain is bad enough.
Okay, so if they do show up here at the office to see you, what are some steps you might take? I know sometimes people think you jump automatically to surgery. I know that's not always the case. What are some other options?
Well, depending on their history and how long it's been going on and what kind of treatment they've had in the past. But initially when you come in, we ask questions. We want to find out how long you've been having this pain. Where is the pain at? What affects the pain? What makes the pain worse? What makes the pain better? We go through a thorough history of the hip pain and the whole process of the hip pain that they're having. We also get x-rays. We want to look at x-rays and see exactly what's going on from an x-ray standpoint, if it is an arthritic problem or something else, or a muscular problem. And then from there, depending on what it is, we generally like to treat people conservatively, which means anti-inflammatory medications if they haven't done that. Sometimes we give injections, steroidal injections to the hip. Physical therapy is an option, and even using a cane at times if it's bad enough. But really, if you come into our office and see us, that doesn't mean that we're going to just automatically say you need surgery for this problem. No, we're going to try to get you better with other things before that. Surgery is only a final option or last option if all else fails.
And in looking at surgery, you hope it doesn't get to that point, but if it does, I know you do the direct anterior approach. Can you talk a little bit about that approach and how that affects hip replacements?
Yes, the direct anterior approach to the hip is a minimally invasive approach to the hip. It's something that's become more, in vogue in the last few years or so. It's instead of going through the classic or traditional way, going through the side or the back of the hip, we go through the front of the hip. And by going through the front of the hip, we use a special table for this, and allows us to get the leg in a position to allow us to get to the hip without cutting any muscle, tendon, or ligaments. And that allows us to do our hip replacement without sacrificing or cutting any muscles, tendon, ligaments, and with that, we're not gonna have to wait for those muscles, tendon, ligaments to heal. It's pretty much inherently stable immediately. After that, we're allowed to be more aggressive as far as physical therapy with this approach to the hip, which means you can do more right away. And the precautions that classically you would have after a traditional hip replacement, not bending over at the waist, not sitting in a chair, not being able to bend at 90 degrees at the hip because of the risk of dislocation. By going through the front of the hip, we don't worry about that. There is no restriction on position. We allow you to do whatever you want to do immediately and increase your activity as you tolerate. So it's a big advantage to have the hip replacement done that way.
And I know you let me watch that surgery when I first started, so I appreciate that. It was fascinating. So that concludes our monthly Ask the Doc session with Dr. Jerry Trinidad here in Portsmouth. He also sees patients in Jackson. No referral required. So we appreciate you watching today, and stay tuned for the next Ask the Doc. Thank you.
Thank you.